There is one new locally acquired case of coronavirus in today's numbers, bringing to the total number of active cases in both the community and in hotel quarantine to 74. It was the Chief Health Officer yesterday who said 1 day of 0 cases doesn't mean the job's done, and that there would be other cases and that we still need to remain vigilant and ready to respond. The new case today lives in the City of Melbourne, and our team will continue their investigations today as to the acquisition source of that case, which came in very late last night. The team spoke to the case last night and is conducting further interviews today. This case has done all the right things. From our initial interviews, the individual recognised that they had symptoms, got tested, and had a test result all within the same day, that is, yesterday. Our public health teams are also continuing their other investigations into the cases in Reservoir and have completed lengthy interviews with the Victorian couple who have tested positive in Queensland. I want to take this opportunity to thank the 15,110 people who braved some pretty rough weather yesterday to get tested. We are now clearly in the throes of winter, and you might just think that the slightest sniffle or sore throat is just something that happens in Melbourne and Victoria in winter, that it's nothing to worry about, it's just part of our winter life. But as we have learnt over the course of this past 18 months of pandemic, we need to respond to the systems of coronavirus, however mild, as soon as we detect them. So please, do the right thing, get tested quickly, and give our public health team the chance and the information they need to stay ahead of the spread of this virus. Lilydale, Yarra Junction, and Emerald testing stations are closed today due to those power outages that we referred to earlier. They are expected to reopen tomorrow, but the communities in the eastern suburbs still have access to nearby testing stations in Boronia, at the Wanturna Trash and Treasure site, and at Ferntree Gully. These alternatives close by continue to operate. When it comes to vaccination numbers, they continue to be strong in Victoria. And yesterday we had another day of over 20,000 vaccinations. This was another day in our state clinics, that is. This is another day of Victorians visiting vaccination centres, and of course, with the majority of vaccines still going to our partners in GPs and our local medical clinics, this partnership between the state and the GPs is delivering strong results for vaccinations. We've seen that every day over the last 3 weeks, really good numbers of Victorians have stepped forward to receive their first dose of the Pfizer vaccine. Under the Australian Technical Advisory Group on Immunisation, ATAGI's guidelines, people who get their first dose of Pfizer need to return within 3 to 6 weeks following that first dose for their second dose, and thus get the full benefits of the vaccine's protection. Some 50,000 people are already booked in for their first Pfizer dose in the coming week, and that is fantastic to see. That's bumping along at the maximum of new first doses we can do, whilst we also deliver the second doses for the tens of thousands of others as they start to fall due. Of course, every first dose booking in the system for the next weeks will proceed. Into the future, tens of thousands of Victorians will continue to be able to book an appointment for their first dose of Pfizer, and new appointments will be made progressively available to people as their second dose schedule falls due. And when more doses are delivered by the Commonwealth, we'll be able to increase the number of bookings for first doses as well. I stress that booking ahead is important given those high levels of demand. Since the commencement of the vaccine rollout in February, Victoria's state clinics have delivered over 772,000 doses. Of those, over 350,000 first doses of Pfizer, over 91,000 second doses of Pfizer, over 320,000 doses of AstraZeneca, and almost 10,000 second doses of AstraZeneca. That's almost 190,000 doses administered by our state-based clinics. That puts us ahead of the next comparable state jurisdiction. So clearly, as more doses become available, we will continue to increase the number of appointments made available for Victorians to book their first dose vaccination. More broadly, when it comes to restrictions, yesterday was a good day with kids back at school, restaurants, cafes and pubs open again with their well-deserved meal and drinks with friends and patrons. And we know that restaurants, cafes, pubs and retail stores are back open again, but clearly with density limits in place, and that's all about making sure that we carefully and gradually reopen safely based on the public health advice. All categories of elective surgery will recommence in metropolitan Melbourne as of Tuesday. This is all about staying COVID safe, and staying COVID safe is the way in which we will continue to carefully and cautiously reopen. As we start this long weekend in metropolitan Melbourne, you still cannot have visitors to your home unless, of course, that is your intimate partner or a single social bubble. You can see friends and families outdoors in public spaces, but in no more than group of 10. Restrictions regarding travel for no more than 25 kilometres from your home, or travel into regional Victoria from metropolitan Melbourne, except for work, for study, for care, or to visit a vaccination centre, continue in place. Importantly, of course, you can leave home in case of an emergency. But please, wear a face mask. It's easy to do and dramatically reduces the risk of the virus spreading. These need to be worn indoors and outdoors unless inside your own home, or in the case of exceptions that apply under the state public health orders. Different restrictions continue to apply in regional Victoria, where you can have up to 2 adults visit your home per day and wear face masks whilst mandatory indoors. They apply outdoors where you cannot maintain a 1.5 metre distance from others. Outdoor gatherings in public spaces in regional Victoria are limited to groups of 20. So my message is that if we all stick to these directions, we increase our chances every day of continuing to drive this current outbreak down and to return as quickly as possible to the kind of life that we want to aspire to, where we were for 86 continuous days of no community transmission. So my message is, please keep applying the public health rules and be doing what we Victorians have been doing for the past few weeks. Use the QR code system wherever you can and wherever you're obliged to do so. Please get vaccinated when the opportunity arises, and please, most importantly of all, get tested at any of the continually operating vaccination centres right across our state. It's the most important thing we can do to stay ahead of this virus, to give our public health team the information, the intelligence they need to drive this virus down to where we want it to be, at no community transmission.